Good morning, everybody. My name's Cassidy, and I'm a third-year nursing student. I'm here to talk to you today about a gentleman named Frank and his experience with a recent hospitalization. Frank, a 65-year-old farmer, presents a unique case of a patient with limited health literacy who experienced an ST elevation myocardial infarction, a STEMI. This case study explores the challenges Frank faced due to his poor health literacy and limited reading abilities in managing his cardiovascular health. His patient background. Frank is a lifelong farmer with a history of hypertension and occasional chest discomfort, which he attributed to his physically demanding lifestyle. Due to his limited education, Frank struggles with reading and understanding medical information. He relies heavily on verbal instructions from healthcare professionals and family members. Frank underwent emergent percutaneous coronary intervention, PCI, with stent placement to restore coronary blood flow. He was started on dual antiplatelet therapy, statins, beta blockers, and ACE inhibitors for secondary prevention.
Frank was admitted to the emergency department with severe chest pain radiating to his left arm and jaw. Upon examination, he appeared diaphoretic and anxious. His vital signs revealed tachycardia and an elevated blood pressure with elevated troponin in his lab results. An ECG confirmed ST segment elevation in the anterior leads, consistent with a STEMI.
Hey Hannah,
Hi Kaylee.
how's it going?
It's going all right. How are you?
Good, good. I just wanted to touch base with you before we do our last discharge for today. So we have the 65-year-old male, Frank Brown, in 52A. He's being discharged, so we just want to make sure that he gets all of his patient education today, especially related to nutrition. That's going to be huge for him. So a little bit of background information. He had a STEMI 4 days ago. He's been managing well in hospital. So we're ready to get him home. We just want to make sure that he's set up for success. So our top concerns with him would be nutrition, and geographical location, because as you know, he's the closest store to Frank is 45 minutes away.
Yes.
So that's a bit of a challenge for him as well. So we'll want to offer some important recommendations with that. And then we'll also want to focus on physical activity for him too.
Okay.
Yeah.
Good points. We also need to remember that Frank only has a grade 5 education level and has low health literacy.
Right.
So I think we should utilize these handheld pictorials that facilitate our teachings. I was
Yes.
researching this because we had a class on it. And
Perfect.
What do you
Those are
think?
great. Yeah, absolutely.
Thanks.
And his wife is at the bedside now too, so we'll include
Perfect.
her in the teaching, and
Okay.
hopefully we'll do that.
Sounds good.
Okay,
let's
perfect.
go.
Let's go.
I can't wait to get out of here and see them cows.
Shh, be quiet, Frank. I hear them coming.
You're the reason I'm in here anyway, sweetheart.
Hello.
Hi.
Hello.
Hello.
How are you guys doing today?
I'm all right.
Good.
You?
Good, good. I'm Hannah. I'm a nursing student.
And I'm Kaylee. I'm an RN.
I'm Frank. This is the wife, Lydia.
Nice to meet you guys.
Oh, yes, lovely to meet both of you. So Frank, I hear today the plan is to get you on your way back home.
Yeah.
How do you feel about that?
I just can't wait to get home to them cows. I miss them real bad.
I bet. So, but before we get you home, we just want to go over some important things that you're going to need to know so that you are able to better manage your condition at home, okay? So, a few things that we're going to touch on is nutrition, physical activity level, and then maybe some challenges that you might face living in a rural community. All right?
Yeah.
Perfect.
Sounds great.
So, if you have any questions or anything along the way, you just go ahead and ask them.
Sounds good.
Okay.
Okay. So we're here to talk to you about the DASH diet. Have you heard of that before?
No, ma'am.
That's okay. The DASH diet stands for Dietary Approaches to Stop Hypertension. It's a way of eating that can help lower your blood pressure and improve your overall health. Would you like to learn more about it?
Oh, Frank, stop it. You have to learn this.
Yes, it is very
Alright.
important for your overall health to learn about the benefits that nutrition can help.
All
with.
right.
Yeah.
Great. So the DASH diet focuses on eating foods that are low in sodium and rich in nutrients like potassium, calcium, and magnesium, and high in fiber. Another important aspect of the DASH diet is reducing the amount of saturated fats that you consume. So saturated fats can raise your cholesterol level and increase your risk for heart disease.
So what kind of foods contain these saturated fats you're talking about?
It's best to limit foods like fatty meats and full-fat dairy products, and foods like pastries and fried foods.
So what about my bacon?
So it's good to limit your bacon and maybe opt for leaner proteins like poultry and fish, and choose low-fat and fat-free dairy products.
All right.
Can you tell me one food that is high in saturated fats that you should try to limit on the DASH diet?
You were saying fish? Is that one of them foods that's high?
No, fish is low in saturated fats.
Oh, it's
Yeah.
low. All right.
So high would be
the bacon.
yes.
The
yes.
bacon in my steak
Yes.
and hamburgers. Ooh, those are
Yes.
good.
They are good, yes. But also enjoyable is fish and chicken.
Yes.
Yeah.
All right. I do like fishing.
Good, that's
I have
great.
a freezer stocked full of fish.
Wonderful.
Yeah. Hear that, Lydia?
I don't really enjoy cooking fish.
Well, we're gonna have to eat it more.
Yes, so we do have some visuals here as well.
Oh, I can't read that. That's for you, sweetheart.
Oh, thank you, Frank.
Okay, so this really shows a balanced diet and what your plate should look like. So you'll notice here that half of the plate is full of vegetables and fruits, and then 1/4 of the plate is your proteins, and the other 1/4 of the plate is whole grain foods.
All right.
And we'll also have a list that we'll send with you of examples of fruits and vegetables, what your whole grain foods would look like, as well as healthy proteins.
All right. I notice here there's not a lot of meat, but I do see that there's that chicken and fish you were talking about.
Right, exactly.
All right.
Yes.
And some eggs. I do like my eggs. I can keep eating eggs.
You can keep eating eggs,
All right.
absolutely.
Good to know.
Yes.
Look at this, sweetheart. Isn't that nice?
Thank you, Frank.
Yeah.
Do you have any questions, Lydia?
No, I think it's all good. So we gotta make sure to eat some more fruits and vegetables and some whole grains, and we're gonna avoid the fatty meats. We're gonna avoid your sugary drinks that you like, and then we're gonna decrease your sodium intake.
Right, exactly. Yeah. So focusing on, it's really important that you drink all of your calories. So instead of drinking juices, things like that, opt for more water, stuff like that.
Water.
Yeah.
All right.
Yeah.
Yeah. Okay.
So Frank and Lydia, we did cover a lot of information today, and we just want to make sure that you're well prepared for going home. So can you just explain to me a couple of things that you learned today with us?
Okay, well, I know that I have to decrease my intake of the saturated fats, which
Right.
are the bacon and my fatty meats and my high-fat dairy products. Real sad, but that's all right. Increase my fiber intake, increase my nutrient intake, and also decrease my sodium intake.
Right.
That's correct.
Yeah,
And
that's
not
exactly
to drink
right.
my calories.
Don't drink your
Drink
calories.
some water.
That's right.
Yeah. All right.
Good. And are you feeling okay with all of that?
Yeah, I feel all right. Lydia's got a good list of things here, and
Yeah, these are really helpful.
Yeah, and I got the
Good.
nice list you gave me here, which is really nice for visual.
Perfect. Okay, good.
Could you tell us maybe an example of what you would eat for supper tonight?
For supper tonight, well, we can have some of them carrots and maybe some potatoes, half the plate,
Yes, half the plate.
and then maybe some rice. I like rice, and maybe some salmon we have in the freezer.
Yeah, we have lots of fish in the freezer, so
Yeah.
that'd be good.
Okay,
Real
good.
good.
Yeah, that's a
sounds
great.
good.
Yeah, that's a
Alright.
great example of a meal.
All right. Awesome. Thank you very much.
You're welcome.
You're welcome. So I know that while living in a rural community, you might face some challenges with grocery shopping and things.
Mm.
How often do you go grocery shopping?
How often? There we go.
Well, since we live about 45 minutes away, we only go about twice a month, which makes it challenging to get fresh produce that will last for
Right.
those 2 weeks.
Right. Yeah. So if fresh produce isn't readily available to you, that's okay. There's still ways to follow the DASH diet effectively. So since frozen and canned vegetables are more accessible, you can rely on them as alternatives to fresh fruits and vegetables. These options are still nutritious and can be just as beneficial to your health.
All right.
Yeah, so it's essential to choose frozen or canned vegetables without added salts or sauces. So look for options labeled as no salt added or low sodium.
All right.
So those will be right on the packages.
Okay.
This way you can control the amount of sodium in your diet, which is crucial to managing your blood pressure.
And that follows that DASH diet you were telling me about.
Yes.
Exactly.
It does,
Yeah. So if you don't have the fresh produce, then the DASH diet will still be effectively followed with
Alright.
fresh or with frozen cans and vegetables.
Okay.
Yeah.
Sounds great.
So Frank, in your own words, could you summarize what you just learned?
Yeah, so you want me, when I don't have the access to the fresh fruits and vegetables, to get frozen or canned. And what was it again about the canned vegetables, dear?
You're gonna make sure that they have low sodium and no sauce, dear.
Yes, no sodium and no sauce, yeah. And actually, my brother actually has a fresh produce stand down the road, and we can go there in the summer and get them all the time.
Some fresh
That's
produce.
wonderful.
That's great. Yes.
Yeah, it's great.
Yeah,
Perfect.
great.
Do you have any questions?
No, not right now.
Now, let's talk about your job on the dairy farm. So working on a farm can be physically demanding, so it's essential that you take care of your health while you work.
Yeah.
Make sure to stay hydrated by drinking plenty of water throughout the day, especially during hot weather in the summer and when engaging in strenuous activities.
Alright. Yeah, so my grandsons actually are going to help out on the farm. We discussed this earlier.
Okay.
And I'm going to be on the tractor more often, so I'm not overexerting myself. And also, I will drink lots of water.
Sounds good. That's a good
Yeah.
plan.
Yeah.
Perfect. Okay, so another thing we have here for you is just a follow-up appointment with a registered dietitian.
Alright.
So your appointment is for next Wednesday. And
Alright.
it's going to be here at the hospital.
Can't read
I'll
that,
take
dear.
that.
And when you leave here today, I just want you to make a phone call to your primary caregiver. We're going to fax over all the information so that they know what occurred during your hospital stay. And you'll just want to meet with them as soon as possible.
All right. Thank you very much, ladies, for your help today.
Yes, it was so lovely to
Thank
see
you.
you guys.
Yes. I hope I never see you again.
In the best way
Yes,
possible.
we never
In the
want to
best
see
way
you either.
possible.
Discharge teaching has been provided, focusing on nutrition and physical, also considering the rural location. We use the teach back method to ensure optimal understanding. The patient was able to explain the teaching back to the nurse and student in their own words. We provided visual educational graphs for the wife and the patient at the bedside. We also gave them a card with scheduled appointment with dietitian and instructed patient to call primary care provider to schedule a check-in for next week. Patient and his wife seem very understanding and have no voice concerns or questions at present time. Blooper!
3, 2, 1.
Yeah.
Action. That's a blooper.
Frank, a 65-year-old former.
And I've ripped it out and I threw it in the garbage can.
Yeah.
And then I was driving the tractor. And I had a heart attack.
Heart attack,
It
yeah.
was just crazy. You know,
Yeah.
kids